Well, as we head into what's predicted to be a very tough time with some more bad news about deaths or difficulties from this pandemic, there are also some amazing things happening to help people struggling with anxiety and even those suffering from abuse right now. Patricia Rehmer is a senior vice president for Hartford HealthCare and president of the Behavioral Health Network. Thank you so much for being with us.
Sure.
Hartford Mayor Luke Bronin just announced a new team to focus on domestic violence calls because they've actually increased by as much as 20% during this pandemic time. Can you talk to us about the risk of abuse during this time of isolation?
Sure. I think that people being isolated and in same houses, sometimes in very small quarters, but certainly for hours on end, does put people at risk. We're stressed. People are more stressed, they may be out of work, they may have financial issues, and so after a couple weeks of this, tempers can start to flare. And it's important that people who are at risk or have been involved in domestic violence prior to this really try and take some measures to keep themselves safe.
So how can one avoid or even prevent the escalation of emotions from turning into something, even if it's not abuse, maybe abuse, but just losing your temper with your family?
Right. I think that is very much a concern right now. I mean, I think that there are some things people need to find a way, even though we're worried about isolation, people still need often to find a way to have some alone time. You know, especially if you're an introvert, it's very difficult to constantly be with other people, especially if the TV's constantly on and you're getting more and more anxious about this situation. So I think people getting out of the house, going for a walk, obviously not going to places where they're going to be mingling with other people, but just getting some alone time is really critical. If there's room in the house to get away from the TV, if you don't want to watch the TV and your spouse does, for example, just finding some time to get some distance from each other is very important.
And what about those who are suffering from mental health issues? The social isolation can really aggravate existing conditions. So what behavioral health options are there now?
So I think that's really critical. People with behavioral health issues may be seeing some of their symptoms exacerbate. Certainly we're concerned about people who might, for example, be struggling with obsessive compulsive disorder. This kind of feeds right into their worst fears. Many behavioral health places are staying open. Many of the agencies are staying open. We're certainly open at Hartford HealthCare across our behavioral health network to do intakes and evaluations. We're using telepsychiatry extremely successfully, so people don't even actually need to leave their home if they don't want to. In addition to that, we have a warm line that we have brought up. This is, again, a warm line, not a hotline, but it is staffed by individuals in recovery. And if somebody just wants to chat with somebody because they have some concerns, they could call that number. That number is 888-984-2408. And I'm sure we'll have that up on our website as well.
Yeah, we'll make sure to get that in an easy way for viewers. And that would be free for people.
Absolutely. It's in effect from 5 p.m. to 11 p.m. right now, Monday through Friday. We are looking at whether we need to increase those hours of availability. And if you call before 5 o'clock, you can leave a message and somebody will call you back.
What's your advice for people to process the information, especially as the number of deaths will likely rise over the next couple of weeks?
Yeah, I think it's very difficult. Obviously, deaths are occurring, and the problem is that we are in some ways interfering with a normal grieving process. So people are not able to have any sort of either celebrations of life or funerals, and so some of those rituals are really important for grieving. So we are concerned about that as one issue. And I think the other thing is, as this moves into Connecticut and we're preparing for the surge, I think that people have to anticipate that their feelings could become more intense, and so the need to reach out to people is really critical.
When you talk about staying grounded, I think that means different things to different people. How do you stay grounded and perhaps even positive through this?
It's really important, and I think that people do have coping mechanisms that may in this time even be forgotten. So things like yoga meditation, mindfulness, as you said, exercise. These are all things that are really helpful to people's mental health. And so we really are encouraging people. There's lots of yoga classes online. There's lots of exercise classes that you can get online or on TV, or doing it by yourself, obviously. But those things are very important to keep doing if it's something you've been doing, and maybe start if it's something you haven't been doing.
Right. A lot of free apps out there. I know our company, I'm thankful to the Meredith Corporation, gave all of the employees here free subscriptions to an app called Stop, Breathe, Think. So even if you've never done it before, sometimes these guided meditations can teach you mindfulness right on your phone.
Right. There are lots of apps like that that can really assist with mindfulness and meditation.
And a lot of science that it really does help, something as simple as breathing, but
Absolutely, it does help. Taking deep breaths just a few minutes every day can help people manage their stress. People need to remember to breathe and do that for themselves.
We're going to be having a story on exactly how to breathe properly to reduce anxiety coming up on the news tonight. But we want to just thank you for your time, Patricia Rehmer, for being with us and letting everyone know about the resources that are available.
Thank you.
Thank you.